I'm going to talk about something that I haven't talked about before in detail. For the purpose of reach for this video, because I think it's important, this is for entertainment purposes only. I'm not a medical doctor. None of the details that I'm giving you should be used as medical advice. I always will tell you to find the right doctor for you. And I mean the right one. Do your research and always ask your doctor's opinion. Before I knew Ella had a genetic mutation that was very rare called P10, which doesn't always cause autism. Before I knew how strongly the MTHFR mutation ran in my family, before I knew she had autism, before everything, when I was pregnant, I went into labor at 34 weeks. I was having some pretty extreme back pain. I had a doctor's appointment. I was still working. I left work. I went to my doctor's appointment. He checked me. He checked me again with a very concerned look on his face. You're dilated. You're dilated 2 centimeters. I was in shock. My first child, I didn't know what to think. I didn't expect that. I was like 80% effaced. Also, he told me to go right to the hospital. By the time I got to the hospital, I was 3 centimeters dilated. I think I was still like 80% effaced. I had known someone else that had just recently had a baby, and she went through this where she was in labor. They gave her a shot, sent her home. She was fine. She went about her normal pregnancy and delivered on time. I thought this would be a similar situation. Immediately, I was given, I believe, the shot to stop my contractions. Didn't realize I was having contractions. Obviously, that's where the back pain came in. Along with that, I was given the pill to help slow my contractions. Both of those came very close to one another of being given to me. In my mind, I still thought, okay, they're gonna stop this. They're gonna monitor me for a while because I had already been monitored a little bit during this pregnancy for high blood sugar. I never turned into gestational diabetes, but I was very close. I thought I was going home. I thought this would be fine. The shot didn't work. The pills aren't working. I'm still actively progressing. I'm at 34 weeks, I think pretty much on the day. They then tell me that because I tested positive for strep B, which is something they don't give you a lot of explanation on. Either you have it or you don't. Supposedly, it's passed down from your mother. Unless you're given antibiotics to treat that, your baby is susceptible to getting it as well. It doesn't affect you whatsoever as an adult. They don't want the baby contracting it. But apparently you can go on with your life and you can have it and it's no big deal as an adult. And also, it can come and go the more I research about it. Like if you're on the proper amount of probiotics, you can get a negative strep B test. And that actually happened to me with my second child. So because I tested positive for strep B, I had to be on antibiotics immediately because there was a chance I could give birth very quickly. Because I was continuing to progress, they had to start me on an IV of antibiotics. I can't remember the exact schedule of how this occurred, but I believe it was like 30 minutes of antibiotics and then 30 minutes off, or maybe an hour off. But it wasn't that much time where they had me off. The day goes on and progresses, and labor is not stopping. At this point, they suggest giving me an IV of magnesium. Okay, I mean, that's the next step. They're telling me that this is what they have to do. I am told that obviously it's not going to be ideal to give birth at 34 weeks, so the best option is the magnesium. I trusted my doctor. This is the protocol. So I'm given the magnesium. At this point, I've had the shot, I've had the pill. I have an IV of antibiotics, and I now have an IV of magnesium. My mom gets there. I remember she was involved in helping me make that decision. And I am a person that's very cold all the time. They told me that you might get very hot. You might have blurred vision. Might be kind of out of it a little bit. I was like, okay, like that all sounds great when I'm pregnant with a child. Like that can't hurt the baby at all, right? All I could do was remain calm because any stress that I was under that wasn't necessary was only going to be transferred to my child. I'm on the magnesium and I start getting so hot that they turned down the air conditioner to like the lowest it would go in the room. Everyone that came in and out were freezing. I could not be cold enough because I was on fire. My vision was so blurry. Everything was, I couldn't see that far in front of me. I remember being in and out of it. All of a sudden, another family member was there, and I didn't even realize that they got there because I was so like in and out of it. I felt like I was partially like falling asleep and partially coming to. Then my husband got there, and at this point I had those airbags they put on your legs to make sure that you're getting the proper circulation. And they had a catheter that they hooked up to me, and he walked into that. And I had told him, like, it's no big deal. You know, you're fine to finish out the day at work, because I was so out of it from the magnesium. He walked in and was in shock. And I don't think he realized what he was going to walk into. I certainly didn't realize it was going to progress to this so quickly. The contractions still aren't stopping. They say, okay, now we have to give you 2 steroid shots because we have to develop this baby's lungs just in case. Can't remember if they gave me 1 like that day and maybe 1 the next day, but there was 2 I had to get in the matter of hours. I was given a pill to stop my contractions. I was given antibiotics through an IV. I was given magnesium through an IV, given steroid shots to help develop Ella's lungs, just in case I gave birth and these contractions didn't slow down. Of course, what's running through my mind is not myself and how I feel. How is all this going to affect my baby? Eventually, the contractions slowed down to the point where I was just being monitored. I don't think I was continuing to dilate, and I was remaining like the same, like 80% of face. They kept me overnight. I was there for 9 days. I never imagined this would be my pregnancy journey. So eventually, after 9 days, I was released from the hospital. I was on a pill to slow my contractions the entire time. They sent me home, and I was not able to get up unless it was just to use the restroom and go back to bed. I had to take the pills to slow my contractions, I believe, twice a day. It was like a certain time in the morning and a certain time, so many hours apart. Now, I'm not saying the doctor did anything wrong. This was protocol. This was, I believed, necessary in order for Ella to not be born premature. I ended up needing my water broken, which funnily enough, eventually I got to be like 37 and a half weeks. And the doctor said we weren't going to prolong this anymore. He sent me to the hospital, had them hook me up to everything and get the antibiotics started again because we were going to break my water at like 9 p.m. that night. I had to be on antibiotics because I had the strep B positive test. So of course I stopped taking the pills to slow my contraction, and I get my water broke at 9 p.m. Things progressed pretty quickly to the point where I couldn't even get an epidural if I wanted one. By the time I was thinking about it, even because it wasn't part of my plan that I wanted that, but I was just going to play it by ear, they said check her again, and they said she's at a 10, she's ready to push. I did not get an epidural with her, but I feel like I got everything else under the sun. Now, I'm not telling you that I know anything for sure. I am asking if you are a person that is genetically susceptible to low glutathione and you're in your mother's belly, if you are receiving things that lower your glutathione in utero before you're even born, and you're receiving antibiotics through your mother before you're even born, because those are going to the baby too. So your gut starts off just horribly imbalanced before you are born. Your mother just keeps receiving these things that are potentially lowering your glutathione. Or I'm just asking, do you think they would if you were predisposed to being susceptible to that? Then you're born and there's all of these things that are given to you after the fact, and your body just cannot replenish itself or recover. So if this was your experience, your journey, and this is what you had been through, would you wonder about if any of that affected your child, who was then diagnosed with level 3 autism, regressed from saying 50 to 75 words at between 15 months and 2 years to saying no words at all by the time they were 24 months? Would you wonder if any of that could have affected them? Or there could be something that they're predisposed to in their body that some of those things were not good for them to receive. And I'm not saying that they weren't necessary at the time. I'm not saying that she should have been born premature and taken that risk. I'm not saying that. Would you wonder Would you take things very seriously after experiencing that?